Hey guys, so I did my abnormal behavior psychology project on Meredith Palmer from The Office. And so for the treatment project, obviously I'm going to be treating her. So yeah. So a little bit of recap and background on Meredith Palmer. Her name is Meredith Elizabeth Palmer. She's a character on the fictional comedy series The Office. Meredith Palmer shows the symptoms of alcoholism, alcohol dependence, which is also known as alcoholism or alcohol use disorder, and she also was diagnosed with substance abuse. She was born on May 12th, 1959. She has 2 ex-husbands and 2 children, Jake and Wendy, and she's portrayed by Kate Flannery. So, diagnosis. She was diagnosed with alcohol dependence, and also known as alcoholism and alcohol use disorder, as I said. The DSM definition is a problematic pattern of alcohol use leading to clinically significant impairment or distress. This includes toleration and withdrawal. And then substance abuse, which she was also diagnosed with, is it comes in 3 levels of severity, which are mild, moderate, and severe. They're determined by the diagnostic criteria that the individual meets. Substance abuse occurs when reoccurring use of alcohol or drugs provokes clinical and function impairments. These may include health issues, disability, lack of responsibility, social impairments, control, and risky use of are signs of substance abuse. So next, the possible treatments for alcohol dependence. Let me get out of the way. The possible treatments include counseling from a healthcare professional, behavioral therapy or CBT, cognitive behavioral therapy, a detoxification program, which are typically held in hospitals or medical facilities, and then you can also be prescribed medications for an alcohol problem. Next are the possible treatments for substance abuse. The possible treatments for substance abuse are behavioral therapy, CBT, cognitive behavioral therapy. So like alcohol dependence, they have that treatment in common, and also medications they have in common. So they're treated in very similar ways, I guess, because they are kind of similar behaviors. So next is the treatment that I recommend for Meredith Palmer would probably be behavioral therapy / counseling. Since she does have multiple abnormal behaviors, the 2 I focused on were substance abuse and alcohol dependence, because those are 2 major and most severe ones. I tried to use one of the treatments that those 2 had in common, so I decided the best option and the one that they both had in common, so that she could treat both at the same time, or I could treat both at the same time, would be behavioral therapy / counseling, or CBT. So behavioral therapy or cognitive behavioral therapy, CBT, serves as a treatment for both substance abuse and alcohol dependence. This therapy is considered a psychotherapy treatment, and for this type of therapy, a mental health professional, either a psychiatrist or just a therapist, not a psychiatrist, a psychotherapist or a therapist, works and discusses the abnormal behavior or behaviors with the patient in a constructive way throughout several sessions. I say several sessions, but this type of therapy, CBT / behavioral therapy, is typically used short term. It's typically a short term therapy. So then I just have this video on CBT. I tried to find a video that simply explained the idea of CBT and how it's typically used. So yeah, the title is Cognitive Behavioral Therapy Simply Explained, so go figure. So yeah, that's what I included because it kind of goes over the aspects of behavioral therapy / CBT. And it was really easy to understand, really helpful. So yeah. So next, I have a description of the treatment. Behavioral therapy / counseling. Who discovered it? Ivan Pavlov and B.F. Skinner, which you've probably heard both of them throughout our psychology course because they're pretty crucial figures throughout the course. So I thought it would be good to include them. And they are who kind of discovered it, like they kind of developed it, and yeah. So they developed classical conditioning / operant conditioning, which kind of, I don't know, is in the same area of behavioral therapy and CBT. So it kind of tag teams with CBT and behavioral therapy. So classical conditioning is where a neural stimulus comes before a different stimulus, therefore triggering a response which eventually will become a reflex. So when did this come about? This came about in 1953 when B.F. Skinner was involved in a research project which discussed conditioning, and it included how it would potentially be used in order to improve the functioning of those diagnosed patients. So where did it happen? Where did it happen? Behavioral therapy overall has about 3 main areas that it is most prominent, I guess you could say. Those 3 main origins are South Africa, the United States, and the United Kingdom. B.F. Skinner is mainly associated with the work within the United States, or he's most known in the United States for his work. So, yeah. So next, the treatment course. So behavioral therapy and cognitive behavioral therapy are normally short-term therapies, as I said earlier. The average amount of sessions are typically 10 to 20 sessions are typically underwent. So a different number of sessions may be considered depending on the severity of the patient's problem. So depending on how you cooperate and how well it goes, and how severe your suffering, or not suffering, but how bad your behaviors or whatever you're treating is, there's a lot of factors in how many sessions you may have to go through. So therapists typically consider these things, or the following things, before deciding how many sessions may be needed or how many sessions you may need to come in and see them. So those include type of disorder or the situation, the severity of your symptoms, as I said, how long you've had your symptoms or have been dealing with your situation, how quickly you make progress, and how much stress you're experiencing, and lastly, how much support you receive from your family members. So because Meredith Palmer from The Office, some of the episodes show her coworkers, like her boss, Michael Scott, in an episode tries to put her in rehab, but she kind of doesn't want to go, and she rebels and, I don't know, acts up. So if she were to undergo this treatment, or she may not want to face her issues, she may not cooperate, she may not make progress very quickly, and her problems are very, very severe. She's a major alcoholic. She abuses alcohol. So, and it's pretty severe, so she may have to undergo more than the average 10 to 20 sessions. So, yeah. So then there's my works cited, and that's it. So, yeah.